If you're over 60 and still touching yourself the way you did in your 20s, you might be putting more strain on your body than you realize. What once felt harmless when you were young can silently cause problems. Now, problems with sensitivity, circulation, and even your prostate. In fact, research shows that most older men continue this habit in ways that no longer fit their biology. And 3 common mistakes affect nearly 8 out of 10. These mistakes can quietly reduce pleasure and damage long-term health. I'm Dr. Kayler, a urologist who has spent more than 20 years helping men protect their vitality and confidence as they age. Today, I'll show you how to masturbate safely after 60, the mistakes to avoid, and the steps that can keep this part of your life healthy and fulfilling. First, let's clear the air. Masturbation itself is not shameful and it is not harmful when done with awareness. It remains a natural, safe way to relieve stress, boost circulation, and even support prostate health. The challenge is that your body at 60 is different from your body at 20. Skin is thinner, nerves are more sensitive to trauma, and hormones follow a different rhythm. The techniques that once worked may now cause irritation or reduce sensitivity. If you keep adjusting to these changes, masturbation can remain an important form of self-care. If you don't, frustration and discomfort can creep in. The first mistake is using too much pressure, what many call the death grip. This habit forms gradually. As men notice declining sensitivity with age, they tighten their grip to recapture the intensity they once felt. At first, it seems like a practical solution, but over time, it teaches your body to respond only to extreme pressure. That creates 2 problems. Natural sensitivity fades, and intimacy with a partner becomes less satisfying because normal touch no longer registers as enough. Medical research supports this. A 2016 study in the Journal of Sexual Medicine showed that repetitive high-pressure stimulation can damage nerve endings in the penis. These micro-injuries often don't cause pain right away, but they reduce sensation over years. Men describe it as feeling numb or only able to climax with one very specific technique. Some even report irritation and soreness after masturbation. Clear signs that tissue is under stress. The solution is to retrain your nerves. That starts with easing the pressure. If a lighter touch feels less stimulating at first, remember that nerves can recover and adapt. I often teach patients a method I call the rotation technique. Instead of the same tight, repetitive grip, experiment with changing direction, using more surface area and slowing the pace. This variety stimulates nerves in different ways and prevents the body from becoming dependent on one pattern. Lubrication is another key. A natural, unscented lubricant reduces friction, so you don't need to squeeze as hard. It allows smoother motion and opens the door to lighter, healthier touch. Think of the goal not as finishing quickly, but as giving your body a kind of massage. Over time, you'll likely notice sensitivity return, orgasms becoming easier, and intimacy feeling more natural. Your penis is vascular tissue designed for gentle blood flow and subtle stimulation, not crushing force. By changing your approach, you protect its function for the long term. The second mistake is what I call the timing trap. Many men fall into a routine of late-night masturbation, often rushed as a way to fall asleep. On the surface, it looks harmless, but at this age, timing matters. Testosterone, the hormone most critical for sexual health, follows a daily cycle. Peaks in the morning and drops to its lowest point at night. That means your body is naturally more responsive earlier in the day. When you wait until late hours, you're working against your hormones. There's more. Engaging in quick late-night sessions can disrupt melatonin, the hormone that regulates sleep. Studies from the Mayo Clinic and others show that poor sleep patterns lower testosterone, even further creating a vicious cycle. You feel less energy, your arousal weakens, and your recovery slows. On top of that rushing, the act keeps your body in a stress response. Your heart rate jumps, but your blood vessels constrict instead of relaxing. Instead of boosting circulation, you're blocking it. The remedy is to choose better timing and slow down. Morning or early afternoon are often the best windows for men over 60 when testosterone is higher and your nervous system is more relaxed. Before beginning, take 2 or 3 deep breaths, roll your shoulders back, and let your body know it's safe. Even adding 5 extra minutes to your practice can transform it from mechanical release into restorative self-care. This slower, mindful approach not only feels better in the moment, it brings lasting benefits. Men who align with their body's natural rhythms often notice steadier moods, deeper sleep, and more reliable erections. Masturbation becomes a tool for health rather than a quick distraction. Think of it as a ritual like stretching before bed or walking for your heart. Done with care, it strengthens rather than depletes. The third mistake is ignoring the prostate connection. Most men rarely think about how masturbation affects their prostate, but the link is real. On the positive side, ejaculation helps flush the prostate and keep fluids moving. A large Harvard Medical School study found that men who ejaculated 21 times per month had a 1/3 lower risk of prostate cancer compared to men who ejaculated less often. Regular release keeps the gland healthier. But here's the risk. How you do it matters. Certain positions, such as sitting on a hard chair or putting direct pressure on the perineum, the area between the scrotum and anus, can strain the prostate. If you already have enlargement common after 60, this pressure can worsen urinary symptoms or trigger inflammation. Warning signs should never be ignored. Pain or swelling after masturbation, difficulty urinating, or blood in the semen are red flags that call for medical evaluation. These may signal prostatitis or other conditions that require treatment. Too often, men dismiss these changes as just age, but early attention can make all the difference. To keep your practice prostate-friendly, make a few adjustments. Choose positions that support your body without pressing on the pelvic floor. A soft chair or recline posture is far better than sitting upright on a hard seat. Use lubrication to reduce friction. Drink water before and after, since good hydration supports both circulation and gland health. And most importantly, listen to your body. If something feels wrong, stop and adapt. Masturbation should never leave you sore or uncomfortable. By now, we've uncovered 2 of the most common mistakes: excessive pressure and poor timing. And we've begun to see how prostate care plays a vital role in safe self-pleasure. These 3 lessons alone can reshape your approach and protect your health. But there is one more hidden factor that holds many men back. It has nothing to do with technique or biology. It has to do with the beliefs you carry, the quiet guilt or shame that may shadow your experience. In the next section, we'll break down how this shame cycle forms, how it sabotages your enjoyment, and how you can finally set yourself free to enjoy a healthier, more confident connection with your body. For many men, the most damaging obstacle isn't physical at all. It's emotional. The shame cycle has followed them for decades. Perhaps as a boy you were told that masturbation was dirty or sinful. Maybe you learned to hide it to keep it a secret. Those early messages don't just disappear. They live quietly in the background, shaping how you see yourself even in your 60s or 70s. At this age, when your body already responds differently, shame can grow heavier. You might wonder why you still feel the urge. You might ask, shouldn't I be done with this by now? Those questions create doubt and guilt, turning a healthy act of release into a moment of self-criticism. The trouble is that guilt doesn't just stay in your head. It affects your body. Stress hormones like cortisol rise when you feel ashamed. Elevated cortisol reduces testosterone and interferes with blood flow. 2 things your body needs to function well. Anxiety tightens your muscles and shortens your breathing, making arousal less satisfying and orgasm harder to reach. Over time, The shame cycle teaches your brain to connect masturbation with stress rather than relaxation. Instead of a calming outlet, it becomes a trigger for frustration. It doesn't have to be this way. The first step to breaking the shame cycle is reframing the act. Remind yourself that this isn't about weakness or immaturity. It's biology. Your body still produces sexual energy. It still needs healthy outlets for circulation and gland function. Masturbation is simply one of the body's ways of maintaining itself. When you look at it as maintenance rather than misbehavior, the guilt begins to lose its grip. Science supports this perspective. Data from the American Urological Association shows that around 70% of men over 60 still masturbate. Not only is it common, it carries benefits: improved mood, better sleep, and reduced risk of prostate issues. You are not the exception. You are part of a vast majority. Naming this fact is powerful because it helps replace secrecy with acceptance. For some men, changing the language helps. Instead of thinking of it as something shameful, call it self-touch or even self-care. Just as you stretch to ease stiff joints or walk to support your heart, this practice supports your sexual system. Others find it helpful to talk with a doctor or counselor, someone who can normalize the behavior and offer reassurance. What matters is breaking silence. When you stop carrying shame alone, its power fades. Now that we've covered the 3 major mistakes, excessive pressure, poor timing, and ignoring the prostate, plus the hidden weight of shame, let's put it all together into a simple action plan. Because knowing the risks is only half the battle. You need clear steps you can follow. Here's a 7-step checklist for safe, healthy practice after 60. First, choose a comfortable, private setting. A relaxed environment helps your body let go of tension. Second, keep your hands clean. This protects delicate skin and reduces the chance of irritation or infection. Third, use a natural lubricant. This reduces the need for force, prevents friction, and makes it easier to experiment with lighter, healthier touch. Fourth, take your time. Slow your breathing, notice the sensations, and treat it as care rather than a task. Fifth, use a gentle grip. Variety and lightness allow your nerves to respond in healthier ways. Sixth, pay attention to timing. Morning or early afternoon align best with your hormones and promote deeper sleep at night. And seventh, monitor your prostate health. If you experience pain, swelling, or blood in your semen, consult a physician promptly. As for frequency, there is no strict rule. Most men do well with 2 to 4 times per week. This gives the circulatory and hormonal benefits without overstraining the tissues. If your body feels fine with more, that's not automatically harmful. The key is listening to your energy and giving yourself recovery time. Let your body, not old habits, set the rhythm. When you follow this plan, masturbation becomes more than release. It becomes a tool for wellness. Think of it the way you think of walking for your heart or stretching for your back. Done with awareness, it strengthens, heals, and keeps you connected to your body. Let me close with this. You are not broken. You are not past your prime. You are simply in a new stage of life that asks for more care and intention. By avoiding these 3 mistakes, by respecting your prostate, and by releasing shame, you can keep this part of your life safe, rewarding, and deeply nourishing. And if you want to continue protecting yourself, there is one more step you should not miss. I strongly encourage you to watch my next video. As a prostate doctor, I warn seniors this habit enlarges your prostate. Because even as you improve your own practice, there are other daily habits many men ignore. Habits that can quietly enlarge the prostate and cause serious health problems if left unchecked. In that video, I'll show you what those habits are, why they matter, and most importantly, how you can change them starting today. So don't stop here. Click through to the next video and keep building your knowledge. The more you understand your body, the more you can protect your health, your confidence, and your independence. I'm Dr. Kayler. Thank you for joining me. Remember, safe pleasure is not indulgence. It is part of healthy aging. Your body deserves this care, and you deserve the peace that comes with. Please kindly subscribe to this channel to enjoy our upcoming series.